Let's review the following article. The Do-It Study, ACTGA 5391. Weight gain has become a significant challenge in modern HIV care. While integrase strand transfer inhibitors and tenofovir alafenamide are highly effective, they are frequently associated with weight gain and metabolic changes, especially in people already living with obesity. Today, we are breaking down a major article from Clinical Infectious Diseases that asks a critical question. Can switching to Doravirine, a next-generation NNRTI, halt or reverse this weight gain? Study design and participant profile. The Do-It study was a 48-week, randomized controlled trial. Researchers looked at individuals with HIV who had a BMI of 30 or greater and were currently stable on an INSTI plus TAF and emtricitabine. Participants were randomized into 3 groups. First, staying on their current INSTI and TAF regimen. Second, switching the INSTI to Doravirine while keeping the TAF. And third, switching both the INSTI to Doravirine and the TAF to TDF. The primary outcome, weight and fat mass. The results were quite revealing. At the 48-week mark, switching to Doravirine did not lead to significant weight loss. In fact, all 3 groups continued to gain a small amount of weight, roughly 0.7 to 1.1 kilograms on average. However, when the team used DEXA scans to examine body composition more closely, they noticed something interesting. Those who switched to Doravirine while keeping TAF saw a smaller increase in total fat mass and trunk fat compared to those who stayed on their original integrase inhibitor regimen. This suggests that while the scale didn't move backward, the rate of fat accumulation might have slowed down. The role of TAF versus TDF. A major point of discussion in this study is the TAF effect. When participants switched from TAF to TDF, they saw a notable decrease in fasting lipids, like total cholesterol and LDL. This reinforces what we've seen in other trials. TAF is often associated with higher lipid levels, whereas TDF has a slight lipid-lowering effect. But interestingly, even switching to TDF didn't result in the weight loss many clinicians were hoping for. Metabolic health and insulin resistance. Beyond just weight, the study looked at insulin resistance. There were no significant differences in glucose metabolism between the groups. This tells us that switching to Doravirine is metabolically neutral. It's safe and doesn't worsen insulin resistance, but it isn't a magic bullet for reversing the metabolic changes already established by previous regimens. Scene 6. Clinical takeaways. So, what does this mean for clinical practice? First, switching to Doravirine is a viable, safe option for patients on an INSTI-based regimen who are concerned about weight gain. It might help stabilize fat accumulation. Second, it confirms that weight gain in HIV is complex. Simply removing the offending agent, the INSTI, may not be enough to reverse the weight that has already been gained. We likely need a combination of switch strategies and lifestyle or pharmacological interventions. Conclusion. The Do-It study provides essential evidence for personalizing antiretroviral therapy. While we didn't see a dramatic weight drop, we gained a much clearer picture of how Doravirine behaves in a high-risk metabolic population. If you found this breakdown helpful, be sure to check out the full article in Clinical Infectious Diseases for the complete datasets. Thanks for watching.